Matthew Holt, we made it! The end of the Trump administration, the beginning of the Biden administration. So happy to be here. It's the January 20th, 2021 episode of Health in 2.00.
Jessica, you look good up on that stage. Given who was on that stage a couple of weeks ago, it's much better. But also worth noting, that's the Queen's wave.
I feel like it's appropriate.
Yeah, well, not only the Biden administration, it's the Biden
circumstance wave. Circumstance.
It's the Biden-Harris administration. First time we have a female as on the not on the top of the ticket, but at least going to be inaugurated tomorrow as vice president, and obviously the front runner for the 2024 election, unless Joe's going to come out at 82 years of age. We'll see. Anyway, but a lot to be done. I mean, it's a serious day, right? A lot to be done. We have the vaccine rollout's got to work. We've got to get the economy back into gear. We've got to sort of fix a lot of stuff in healthcare that got broken by the current mob, and not to mention the rest of the economy and God knows what else. So, exciting stuff.
One thing that doesn't need to be fixed is the amount of money, the bundle of money that's being thrown into health tech. Loving that. Oh my God, Matthew Holt, $300 million plus deals today and one SPAC. Like, wow, unbelievable.
How much of that is trickling down to us?
Absolutely none of it yet. But any minute now.
Any minute. We're waiting. All right. Are you ready to go?
Mm-hmm.
Then go.
Let's start with that SPAC IPO news for hims and hers. This was like long rumored and awaited, projecting a $1.6 billion valuation. Matthew, what do you think about this?
Yeah, they had a pretty decent shot of revenue. It was in the 150 million range. I assume it's growing fast. Oh, thank you for fixing my error as usual. But basically, right. They're going to expand a little bit into this online primary care. It's still pretty much for poor people and men with problems, but they have got some psychosocial support stuff, and they will grow as their competitors are, but that's going to be a very competitive market. Roe is even better funded than them, so I don't know how long these individual companies like them and Medicine will survive, but it's going to go fast as primary care gets sliced apart.
Speaking of primary care, more primary care, K Health gets $132 million. This is just a couple months after they closed a $42 million round in November. So another, let me backflip into another pool of money. Tell me a little bit about how this is different, because they've got more chatbot tech, right?
I mean, they're a chatbot a la Babylon, a la Bowie Health, a la Informatica, a la, there's a gazillion of these chatbots. They've got Anthem, that's their big anchor client, and they have a bunch of Israeli technology. It's going to be a tough struggle. They've got now about a third the amount of money in Babylon and a lot more than anybody else.
Wow.
So good luck to them.
All right, what about Paige? They get $100 million. This is a digital pathology company that had a little bit of a scandal a few years ago. Yeah,
they basically took a lot of the Sloan Kettering digital pathology sort of work done over the years, put it into a startup, and didn't compensate the pathologists. They're all grumpy. That seems to be on them now. They have J&J's money and some other venture stuff in there. So I understand digital pathology probably going to be a big deal.
All right, what about Aledade, everybody's favorite ACO management company? They get another $100 million, bringing their total up to $195 million, $2.2 billion rumored valuation. This has got to go public soon.
Well, you got your question in. So, I mean, Fazil Mostashari, right, the bow tie wearing former ONC director, who's the CEO here, their goal is to collate, aggregate, and help independent primary care physicians, small practices and IPAs manage risk like an ACO. Basically take a commercial risk from Medicare. Sorry, take risk from Medicare and from commercial payers. They've been very successful about it so far. It's growing fast, doing well. The valuation is big. Congratulations, everybody. My overall question, though, right, is you're taking the primary care docs get paid a slice of the savings, and then Aledade presumably takes a slice of the slice. So they've got to really grow it much bigger, and I don't know how much bigger and faster they can grow to justify the kind of valuation, the growth that somebody would be looking for. It is in the end, a practice management company, doing it in a different way. So I think it's doing great stuff. I love the people there. You know, it's super smart. Whether it can grow as a sort of massive public company the way that we think of Teladoc or Livongo, we shall see, because it is a one by one getting these primary care docs on board, and there aren't that many of them. So, you know,
you're not trying to silence me, but I just have to ask a clarifying question. Yeah. So I remember, like, maybe this was a couple years ago, David Brailer was talking about how he didn't think ACOs, period, were able to scale. So does this like prove that that is not correct? Or
most ACOs, don't forget, are hospital-based, and the hospital-based ACOs have had real trouble, and they're real trouble showing they've saved any money. Aledade is showing, and some of the other primary care only, you know, doctor-only ACOs, because what are they doing? They're able to reduce the amount of hospitalizations. They're saving money by stopping people going to the hospital. And if you're a hospital running an ACO, by definition, that's a tough thing to do, because you're cutting off your nose to spite your face, basically. The question to me is, you know, you've seen these more organized medical groups like IORA, Oak Street, you know, the folks at ChenMed in Florida and a bunch of others, you know, do this in a more aggressive manner. Can you get distributed primary care docs who aren't there? There aren't that many left. They're all left to do this at scale. They've shown they can do it in a bunch of places. I mean, they were in Maryland and Mississippi and elsewhere. I know they're active. So, you know, but overall, they haven't saved that much money. I mean, they've saved a decent percentage, but they haven't saved like 30% off the top. So it'll spread, it'll grow. It's good. Yeah, it's going to definitely be in line with the new administration, right? Because that's the kind of stuff they like.
Absolutely.
Even more than the old one. So you know, and Farzad may know some people there.
A new era starting. I'm so excited. This is going to be refreshing.
Well, I would say that, but I mean, let's not forget all the stuff we do about healthcare and, you know, telehealth and diversified payment. By far the most important thing in health in the next 3, 6, 9 months is fixing the vaccine problem and getting it done immediately. By the way, on that note, just today, Catalyst to Health 2.0 launched a challenge. If you have a vaccine messaging technology, we want to hear from you today. Go to you can go to the COVID-19 health tech site or search for me on Twitter and find it, because we're running a $15,000 challenge that's going to last a week for a IPA in upstate New York. So,
well, there you go. Hey, good job on the transition of that shameless promotion. Usually you just yell shameless promotion and then stick it in there. So yeah, well done.
But today you noted that it was shameless promotion. Well, it's shameless promotion for a good cause in which people watching this might actually win some money.
Well, hey, all for spreading the money around health tech. Remember, all for it.
It's 15,000, not 100 million.
Oh my God, it doesn't matter. Every penny counts. Okay, to trickle down some of that cash to either one of us, you should find us on Twitter and DM us your best offer. He is over at Bolty Boy. I am at Jess Damasa. And of course, be sure to subscribe to these Health in 2.0 shows by going to thehealthcareblog.com. Hit the email newsletter link there and sign up. You'll never miss an episode. And then you get all sorts of other wonderful content curated from the blog, delivered directly into your inbox.
Happy Inauguration Day, Jessica.
Yay. We'll see you guys soon.